First few days were very intense at the hospital. He had a brain bleed. They administered a probiotic, and that was experimental. All this was happening during the fervor, the ascendancy of the COVID crisis. Imagine also going through all of this during COVID and being in there during the 2020 presidential election. Hey there, it's your old dad here. I wanted to pick up where we left off. Last time we talked, I had just seen my son's eyes for the first time. He looked at me and I looked at him, and we had a transcendent moment. Probably one of the most important moments of my life, if not the most important moment. The first few days were very intense at the hospital. He had a brain bleed. I was told that's normal for a premature child at his stage of development, but it was still frightening nonetheless and dangerous. They administered a probiotic, and that was experimental. We weren't really told that it was experimental, but the nurse did express concern that he had been having problems administering this probiotic to the premature babies and that it had been causing problems. He did not take well to the probiotic. His stomach blew up like a balloon and it turned blue. And it actually looked like he might not make it. The idea behind the probiotic is that it colonizes the gut and prevents another bacteria from getting hold. And that bacteria causes something called necrotizing enterocolitis, which basically eats your intestines from the inside out. It looked like he was going to have surgery, which may mean that he would need a colostomy bag for the rest of his life, or that he could die. And that was just in the first few days. He was intubated immediately, as we had told you earlier. And then they moved him to a CPAP, which is like a face covering, but it was still moving at a frightening rate. I can't even imagine how air can move in and out of a child that quickly, maybe because they're so tiny. He still had chest tubes that were driven between his ribs, removing the extra air as it filled his chest cavity. And he was in a lot of pain. We told them that we didn't want the probiotic administered anymore after we found out it was experimental. We also let them know, because this was a teaching hospital, that we don't really want people who are not fully trained working with our child. They did not like that. So they moved him. They moved him in his very fragile condition, which I don't think was a good idea, to another hospital, which also has a very good NICU. And they immediately gave him the probiotic again. And he got sick again. And we started to realize that we were really going to have to keep an eye on his welfare, and that not everything that was happening was for the best interest of the child. He still had to be fed intravenously. There was no way he could swallow yet. Sometimes they would give him milk on a Q-tip, which did have also a probiotic effect and an immune system boost. They added a thing called a PIC, which is a antimicrobial catheter that feeds the child intravenously as opposed to just a regular IV. They wanted to do the probiotics again. We just outright refused, which caused a lot of friction with the hospital. After about 2 weeks, they moved into a high-flow cannula, and then they put a feeding tube in through his nose. Around this time, my wife's elderly father visited us. I was about 2 weeks in. He kept her company for a few days, and then he had to go. He was not allowed to visit because of COVID. Then the chest tubes were removed. The cannula allowed that to happen. It's just high flow oxygen, allowing the child to breathe on their own. They had to make sure he could breathe on his own and that he wouldn't have to be re-intubated, and that the perforations had healed because he was still accumulating air afterwards. and that his chest cavity wouldn't become infected and need drainage. So then they removed them, and that was really nice to see. Around this time, they wanted to put him on formula. We were a little confused by that. We had always been told that breast milk was better. They were worried about his iron levels, which is normal for a premature baby. And we said no, because there's a lot of other little micronutrients that formula just can't replicate. It was also full of weird things like soy oil and ingredients that are known to have industrial solvents in them. Come to find out, the hospital had a contract with this company. Then the reflux started. His heart rate would dip to a dangerous level, potentially depriving his brain of oxygen. This would happen because of reflux. The reflux would come into the back of his throat and cause his throat to seize up. He would stop breathing in order to prevent himself from aspirating. And this would happen sometimes 2 to 4 times an hour. And you'd have to elevate him and shake him awake a little bit and get him to swallow. And then it would go away. And there was no sleeping. And every time his heart rate dipped, it was potentially going into a dangerous area. It could give him brain damage. Luckily, we had a brain scan before he left, and there was no sign of brain damage, and the brain bleed, of course, had stopped. 2 weeks later, we began to transition to bottle feeding for short increments. They wanted him out of the incubator. I said no. Having livestock, having raised baby birds, having premature lambs, I know how important it is for them to stay warm. And knowing that he's already behind on growth, basically stunted, and the neurological specialist and I had a lot of friction over this. She was worried about neurological development, him hearing and seeing and touching things. I was worried about the fact that he just simply wasn't growing. And I put that in a hierarchy above her interests, what she was worried about. And this was a problem. This is when I realized that all the different people, all the different specialists all feel like their field should be considered just as important as the other one, and that there's no hierarchy, there's no order of importance. They continued to try to get us to put him on formula. We continued to say no. We did the fortification. His iron levels started going up. The nasal cannula was finally removed at about 6 weeks. So he was just breathing on his own, breathing regular air, and his oxygen levels were stable. So he was off the juice, which was really, really nice to see. Around that time, they started insisting that we give him a bath. And we weren't really sure why we would need to do that. We were giving him bath wipes up until that time, and that was working perfectly fine. But come to find out, what it actually was is that they wanted to see that we were able to give him a bath, that we were able to demonstrate to them, to their satisfaction, that we can take care of a baby. And that was an interesting revelation. I heard another lady complaining about it in a room just right up the way from us. Same thing, he's really, really exhausted from it. He's getting cold. It stresses him out. He's not sleeping. All the same complaints that we had. And we finally just told him we're not going to keep doing this. Around this time also, an optometrist started visiting us, checking for retinopathy, which is something that happens to premature babies. It's a blood flow and retinal detachment problem, and they can be blind from it. Turned out he had a little bit of it, but it was improving. Looked like it probably wasn't going to be a problem. I believe it finally resolved itself, if I'm not mistaken, once he was about 1.5 years old. So that was good. Then the hospital decided that we need to come up with a game plan for getting him out of there. We were still at about 8 weeks in, which was, if I'm not mistaken, about 3 weeks before he would have been a full-term baby. And the game plan was that he needs to pass a car seat test. So he has to sit in a car seat for a period of time. I believe it was 1.5 hours. And he has to get through that without any dips in his heart rate. He didn't pass it the first time. So we waited a couple days, tried it again, and he passed it. Then they weren't satisfied with that. They wanted him to do it again and again. And we started to realize that they really don't want him to leave. Now, you got to understand, too, that because of George Bush Jr., actually way back in the day, legislation was signed that says that the government pays all the health care for premature children in the hospital. And God bless him for that. It became quite clear that because it's free, right? It's free healthcare. Hey, let's just keep him here as long as we can. And they started to get really creative in their excuses for not wanting him to leave. And they basically just said they're not comfortable. And hey, let's just keep him here regardless of how difficult it is on you guys and regardless of whether he's actually in danger anymore. And it really just didn't seem like he was. So that was also a very interesting revelation. He did eventually pass the car seat challenge. They continued to change the metrics, but it just got so ridiculous that they finally had to let us go about 5 days before he would have been a full-term baby. Now you got to remember, all this was happening during the fervor, the ascendancy of the COVID crisis. Right when everybody was at their most distrustful, their most fervent, their most disagreeable. There was animosity in the air that was just so thick you could cut it with a knife. It was like, imagine everything that you've gone through with COVID. Everybody's got a story, right? Everybody's got a story. Imagine also going through all of this during COVID and being in there during the 2020 presidential election, right? Imagine that. I can't even describe to you how frightening all that was with all the riots and the sections of the city that had been taken over basically by gangs of protesters, the people fighting in the street, me having to drive there 3 hours a day, there and back, through forest fires and smoke, afraid the roads are going to close. My wife was attacked on the street by someone with a 4-foot-long wooden dowel the day after she got out of the maternity ward. It was just like nothing I've ever experienced. But we got it. We got home. We got him home. We got him on a heart rate monitor. We were there. We got out of there. We did it. And I think it was probably the worst experience of either of our lives. We've talked about it since then. I don't think we recovered from that psychologically for 2 or 3 years afterwards. So our relationships fell apart with a lot of our family. These were people that weren't there for us. They left us for dead. I have no qualms about it. Other people came out of the woodwork. The guy in the convenience store up the street, my jiu-jitsu coach. Joe, I still owe you. I still owe you if you need anything. You saved my house, brother. But yeah, so I guess what I'm trying to tell you guys is I don't wish this on anybody. Now things are better. My wife has lost weight. The second pregnancy went pretty well. She's pregnant again. It's going well. Everything seems to be going well. But yeah, that's the story. If you need advice, if you are going through something similar, I'm here for you. That's why I'm doing this. I just want to offer consolation or advice or just someone to talk to. Maybe I need that for myself too. I don't know. This has been cathartic. I'm glad I could share it with you. If it's helped at all, please like and subscribe and donate at the links below. And stay safe, kids.